Hey everyone, and welcome. We are diving deep into one of the most critical skills you will ever learn in nursing, dosage calculations. Getting this right isn't just about passing a test. It is an absolutely non-negotiable part of keeping your patients safe every single day.
And this quote just says it all, doesn't it? Accuracy is everything. This skill is literally the foundation of safe medication administration. And look, I know it can be stressful. There's really no room for error, but there is a clear path to getting this right every single time. And we're going to walk that path together today.
So here's what we've got on tap. We're going to start with the absolute bedrock, the foundation of safety. Then we'll work our way through oral, injectable, and weight-based calculations using some really practical examples. After that, we'll tackle IVs, and then we'll tie all this math back to your clinical judgment and wrap things up with a little scenario to put your skills to the test. Okay, let's get into it. Section 1, the foundation of safety. Before we even think about solving for X or plugging anything into a calculator, we have to get these core principles locked in. These are the essentials. Now, the great news here is that you have options. There are three main ways to get to the right answer: ratio and proportion, the classic desired over have formula, and dimensional analysis. We're going to look at all three, but your goal is to find the one that just clicks for you, master it, and then use it every single time. That consistency is what's going to save you from making mistakes when you're under pressure. I want you to think of this slide as your Rosetta Stone for pharmacy math. These conversion factors are the vocabulary, and you've got to know them by heart. Seriously, commit these to memory. From milligrams to grams, kilograms to pounds, this is pretty much always going to be the first step in almost every calculation you do. Okay, rounding. Precision matters, right down to the decimal point. So here are the rules of the road. If your dose is less than 1, like that 0.746 milliliter example, you're going to round to the hundredths place, so it becomes 0.75 milliliters. But if your dose is greater than 1, like 1.38 milligrams, you round to the tenths place, making it 1.4 milligrams. This is all about making sure every dose is as accurate as it can possibly be.
All right, with those fundamentals in our back pocket, let's actually start putting them to work. We're going to begin with the most common type of meds you'll give, oral doses, both pills and liquids.
So here's our first problem. We need to give 0.2 grams of phenytoin, but the med cart has capsules that are measured in milligrams. What's the very first thing that jumps out at you? Yep, the units don't match. So before we do anything else, we have to fix that. Okay, let's try this with ratio and proportion. First, we convert 0.2 grams to 200 milligrams. Easy enough. Then we set it up. What we have over its quantity equals what we desire over X. A little bit of cross multiplication later, and boom, we get our answer, 2 capsules. Now, let's look at the desired over have method. A lot of people really like this one because it's so intuitive. Again, first step, convert to 200 milligrams. Then you just plug the numbers in. What you want, 200, divided by what you've got, 100, times the quantity, which is 1 capsule, and that gives us 2 capsules. Simple as that. And finally, dimensional analysis. Now, I know this one can look a little intimidating at first glance, but it's incredibly powerful because the units themselves guide you to the right answer. You just line everything up so that the units you don't want, like milligrams and grams, cancel each other out, leaving you with just what you're looking for, capsules. And what do you know? The answer is still 2 capsules. And here it is, the single most important step, no matter which method you just used, the safety check. Just take a breath and ask yourself, does this answer actually make sense? In this case, yeah, absolutely. If 1 cap is 100 milligrams, it's totally logical that 200 milligrams would be 2 caps. This quick mental check is your final safety net. Don't ever skip it. Okay, let's try a liquid dose. We need to give 0.25 grams of amoxicillin. What's available is an oral suspension that's 250 milligrams per 5 milliliters. So, what's the first thing you're going to do? You got it. Spot that unit mismatch and get it fixed. And this is just a beautiful example of why that first conversion step is so vital. The second we convert 0.25 grams, we get 250 milligrams. And look at that. Our desired dose now perfectly matches the have dose on the bottle. This makes the whole calculation incredibly simple. So the final answer is 5 milliliters. Let's run our safety check. The order is for 250 milligrams, and the bottle tells us that exact amount is in 5 milliliters. Yep, makes perfect sense. We're good to go. Okay, now we're going to raise the stakes a little bit with injectable and weight-based calculations. These often involve high-alert medications, think anticoagulants or pediatric antibiotics. So our precision and our process have to be absolutely flawless.
Let's take a look at heparin. The order is for 8,000 units, and our vial is concentrated at 10,000 units per milliliter. Now, here's a little bit of good news, right? The units already match. We're working in units for both the order and the vial, so no initial conversion needed. We can go straight to the calculation.
The desired over half formula is super efficient here. We just take our desired dose, 8,000 units, divide by what we have, 10,000 units, and multiply by our quantity of 1 ml. Punch that in and you get your answer, 0.8 ml. So the final answer is 0.8 ml. Let's do our safety check. We want 8,000 units. A full milliliter has 10,000. So does it make sense that we need a little less than a full milliliter? Absolutely. The logic is sound.
All right, this is a big one. Weight-based calculations, especially in pediatrics, are a multi-step journey, and every single step is critical. We've got an order in milligrams per kilogram per day, a kid's weight in pounds, and it's divided every 12 hours. Phew. Let's tackle this one step at a time. Okay, let's break it down. Step 1, convert the weight. 22 pounds is 10 kilograms. Step 2, calculate the total dose for the entire day. That's 8 milligrams per kilo times 10 kilos, which gives us 80 milligrams a day. Step 3, the order says it's divided every 12 hours. That's 2 doses a day, so we divide that 80 by 2. That gives us 40 milligrams per dose. And finally, step 4, we use our desired over half formula to find the volume for that single 40 milligram dose, which comes out to 2 mLs. So our final answer is 2 milliliters per dose. And now for that crucial safety check. Our single dose is 40 milligrams. The bottle is 100 milligrams in 5 milliliters. Well, 40 is a little less than half of 100, and 2 milliliters is a little less than half of 5 milliliters. See? The logic holds up perfectly. All right, let's shift gears completely and talk about IV infusion rates. We're moving away from calculating a single amount to calculating a rate of delivery over time. And we'll look at the 2 main ways you'll do this, with an electronic pump in milliliters per hour and with a manual gravity drip in drops per minute. This is your classic everyday IV pump problem. You've got a bag with 500 milliliters, and the order is to infuse it over 4 hours. The pump needs you to tell it one thing: how many milliliters per hour?
And the formula here is refreshingly simple. It's just the total volume in milliliters divided by the total time in hours. So 500 milliliters divided by 4 hours gives us a rate of 125 milliliters per hour. That's the number you're going to program right into that pump.
But what happens if you don't have a pump and you have to set a manual drip? Well, now you're calculating in drops per minute, or GTT/M. This adds a new piece to the puzzle, the drop factor. This is specific to the IV tubing you're using. In this case, it's 15 drops per ml, but you always have to check the packaging because it can be different. This one's a couple of steps. First, because we want drops per minute, our first job is to convert the total time from hours to minutes. So 10 hours times 60 is 600 minutes. Then the formula is volume over time in minutes, and you multiply that whole thing by your drop factor. This gives us 37.5. Now, since you can't give half a drop, you round to the nearest whole number. So our final answer is 38 drops per minute. Okay, let's connect the dots here. This has all been about math, but it's so much more than that. This is a core nursing skill that is directly tied to your success on the NCLEX and, way more importantly, your ability to be a safe, effective nurse at the bedside. This is where calculation turns into professional judgment. So here are some really critical takeaways for both test day and every day on the floor. First, pick one method and become a master of it. Always write out your units. It'll save you from silly mistakes. Remember the rules of zeros. Always use a leading zero for decimals, 0.5, so it's not misread as 5. And you never use a trailing zero, like 5.0, because if that decimal point gets missed, it can be mistaken for 50, which is a tenfold overdose. And I know I sound like a broken record, but always do that final logic check. And look how perfectly this process fits into the NGN clinical judgment model. You recognize cues, that's the order, the patient's weight, the med you have available. You generate solutions, that's you doing the math. You take action by giving the med, and you evaluate the outcome. And you know that safety check we keep talking about? That's you starting the evaluation process before you even administer the dose. That's clinical judgment in action. All right, it's time to put it all together. You've seen the mechanics, you understand the theory, so here's the scenario that's going to require a little more than just a calculation. It's going to require your clinical judgment. Here you go. The provider has ordered 80 milligrams of furosemide. Your patient struggles to swallow pills, but you check the Pyxis and see you have an oral solution that's 10 milligrams per milliliter. Now, doing the math to figure out how many mLs to give is the first step, for sure. But my question to you is, what is your very next action? Think about patient safety, communication, all the rights of medication administration. This is where a simple math problem becomes an act of nursing care.